Good evening. It's a pleasure to meet you all. I'm Claire, CEO and co-founder of Untap Health, and today we're here to talk about crap data. Now, I want you to imagine something for me. This is the lobby to your office, your school, care home, doctors, dentists, anywhere you want. And you walk in and you see this. It says the risk that day to a respiratory virus is medium. What do? Maybe at lunchtime, you sit a little bit further away from people. You have your meetings in a better ventilated space. Maybe you even wear a mask. Now imagine that says diarrhea and vomiting. You definitely wash your hands when you go to the loo. But then, what about if someone you care about has an illness or you yourself are sick? That data is even more important. That's what we do at Untap Health. We lift the veil on illnesses in the built environment. During COVID-19, we saw that around 30% of people never show symptoms. But actually, that's been a problem since way before then. For flu, 3 in 4 people don't show symptoms. This means that illnesses are moving silently amongst us. This is quite scary, but what does it have to do with crap data? Sewage surveillance. It's been used for absolutely decades for COVID-19, Mpox, polio, opioid abuse, and so much more. It's actually really very cool. So you can detect one sick person in 10,000 healthy people in a city from sewage, whether they're symptomatic, asymptomatic, but the really cool thing is right from the beginning of infection. So actually pre-symptoms as well. So pretty amazing. It started off in the 1930s quite terribly. They take some sewage from a city and inject it into a monkey. If that monkey got sick, it either died because it got injected with sewage, or the city had polio. Not the best experiment. We've moved on a bit since then. Now, state of the art is manual. A person comes to the site and takes a sample, drives it to the lab, and analyzes it, then sends the data back. That takes around a week for that data. And once you have that data, kind of redundant for the building, so it's generally only done on city scales. It also costs around £1,000, which means that only governments really do this. What we've done is completely changed that. We've built hardware that can be installed in every school, in every hospital, prison, care home, office. Imagine it could be there. It goes straight in and tells that building about their health. We're starting at the moment with COVID-19, influenza, RSV and norovirus, telling them directly about their health and giving people insights and nudges to help them improve it. And these are just the starting blocks of where we want to be. Any pathogens of concern, we're all worried about pandemics in the future now. That's where we want to be in the future, looking after people, preventing those from coming and getting us. We've actually been working at sites across the UK for the past 2 years. And there's just 2 case studies that I want to tell you about. The first one was testing during the pandemic at an office. In that office, someone had cancer and they were still going to work. We were able to tell them the days they had high rates of COVID in the building and tell them that days they were safer. And that gave them autonomy to wear a mask, wear gloves even, and just not to go to work some days. They never caught COVID at work. It was pretty awesome. Second case study was actually during the Omicron wave in London. We were testing at a very big site. We were able to find Omicron in that office before it was public knowledge in London. We kept them safe. And that's what we want to do for many more people. We started at very humble origins just 2 years ago. So me and my co-founder, Jay, used to work from my flat and visit sewage treatment works in our spare time, genuinely. That's me in a very oversized PPE. They had no women's PPE there. The industry is going to go a long way. We have since done so much. We have a team of 10 of us, and actually 2 of my team are here today. We have also recently got a van and branded it just this year. Still very proud of our van. But the journey has not been without its hiccups. You can see the toilet in the top left-hand corner. That toilet has been with us to marketing events all across the UK. Really like the toilet. It gets some attention. Also a very helpful seat, collects business cards. Generally, great utility. We keep that toilet in our storage unit just outside. It has tables in, chairs, work boots, kind of things you can imagine in a storage table outside. We got robbed. They did not steal the boots. They did not steal the tables or the chairs. They stole the toilet. So unfortunately, we are now without a toilet. However, there's lots to come for us the next 12 months. So if you have any questions or want to curious about anything, please find us afterwards. We want to grow and grow, and we hope this is just the beginning of our journey, so that together we can all be safer with crap data.